Thanks, Heather. Thanks a lot to the organizing committee. Muchas gracias a todos los presentes por atender esta sesión temprano en la mañana. I'm going to concentrate on a strategy the American College of Sports Medicine has been found to be important to involve health professionals in the promotion of physical activity. The first thing I want to say is that we have been trying to change the attitudes of medical students and doctors for many years, and we believe this can be a good start to involve health professionals, especially physicians, in the promotion of physical activity by making it part of daily life counseling in their offices. My colleague, Dr. Novello, who is a professor at Emory currently, has been showing that we can involve health professionals in different levels. For primordial prevention, probably many health professionals can be involved. For tertiary prevention, for cardiac rehab or diabetic programs, probably physicians and sports medicine professionals should be involved. As you can see, we believe that there is a place for every health professional and health interested person in society, but probably we need more specialized people as complexity of the relationship between health and physical activity goes up. We have been working in almost 20 countries around Latin America. We have identified some of you are, especially thanks to Richard Marin, our local leader here in Dominican Republic. You're invited to visit our stand, the Exercises Medicine stand, and if you agree for a short lifestyle counseling, you will receive a book around prescription of physical activity. These are the numbers I would like to share with you. We have already trained 4,000 health professionals in these countries. You can see more than 120 courses to this moment in the last 4 to 5 years. You can see the different medical specialties. You can see we have participants from sports medicine that are really specialists, that are well trained, but we have most of the participants from general medicine, internal medicine, family medicine, endocrinology, pediatrics, and others. And although the invitation has been specially for physicians, we have participants from nutrition, especially in Colombia, Mexico, and other leading countries, physical education, physical therapy, nursing, psychology, and others. Totally about 500 health professionals from different disciplines. We have published some of these data on international literature showing the strategy, showing the numbers, and especially what I'm going to show you now is what the structure of the course is to get hopefully feedback from you. The course has knowledge evaluations. I'm going to focus on some of the pedagogics of the methods we use, and we have evaluated some of the improvements in knowledge we get from these courses. The three basic parts of the course are health benefits and risks of physical activity, screening and risk stratification, and a lecture and practice on general principles of exercise prescription. We have the course is 8 hours totally. It's a full Saturday. We do it on Saturdays. We believe it's the best day of the week to take 8 hours of a busy physician. 2 hours are very practical oriented. We do blood pressure measurements, resting heart rate, and blood glucose. Most of you, if you're physicians or physician involved, would think this is too simple and too obvious for a physician. Most of them is the first time they measure their own blood pressure, their own heart rate and their own blood glucose in many years. Being a cardiologist or being an endocrinologist is very surprising. Body composition is also new for many of them, and a few fitness measurements that are completely new for most of physicians, especially the 6-minute walk test as a fitness, cardiorespiratory fitness evaluation, strength measurements, and flexibility measurements that usually are not done in medical practice and are not taught as part of medical curriculum. You can see some of the activities. And at the beginning we do a 20-item survey. These items contains some of the prescription habits and attitudes of physicians. And here are some of the numbers we had until 2013, like how many minutes you engage as a physician in physical activity, how much you practice. Most of them reported to be active. We consider we have a bias of selection because interested people attend the course voluntarily, and of course these are not typical standard physicians, but physicians interested in physical activity. How often you assess physical activity, and again we have really high numbers compared to what we see in the reality of medical practice, which is more than 50% assessing and recommending physical activity. We do a knowledge evaluation. The questions are brought from ACSM materials and books, and we give an international certification to those who have a score above 80%. This is the knowledge increase. We have already averaged the 4,000 health professionals. It's around 30% knowledge increase. A little disappointing for me that I thought they would start like in 0 and go up to 100%, which is not the reality in education. Already, most of them had some basic knowledge. Most of them answered correct answers in 50%, 60%. But the increase is about 20 to 30% in knowledge, specifically in some of the questions. We give materials, the official materials of the program, of this Exercises Medicine International program, handouts about how to prescribe exercise in each disease. There are more than 30 different pathologies: diabetes, hypertension, dyslipidemia, arthritis, that have handouts already printed in Spanish and English. We have a CD with the slides, the presentations of the course, the whole material, where they can get some of the PDFs of the articles that we have presented, research evidence about the benefits of physical activity. And we have formats to help them prescribe exercise. These are the lectures. And we include a little of role-playing. Physicians are divided in pairs, and they have a role-play, one of them being a patient, the other one being a doctor, and trying to prescribe exercise with the information they get during the day about screening, about risk stratification, and of course about objective measurements of fitness and blood glucose, blood pressure measurements, heart rate. So it's really like the information you have in your daily practice, some questions and some basic objective information to prescribe exercise, and we give them a format and we assess them and give time for discussion in difficult cases where you don't know what to do with your patient. This is the evaluation of the courses about general aspect, practical component, and theoretical component. And as you can see, the evaluation is on a 5-point scale, and it has been very well evaluated by most of the participants. And we have improved some of the areas they were complaining, like lack of time in the practice, or a broader space to discuss, or making some of the lectures a little shorter with less information, giving handouts with complementary information and those. We did a qualitative analysis of the 30 most used words, and they reflect the satisfaction by most of the physicians and health professionals that have taken the course. Here's a list of testimonies you can read now in English from different countries, showing the personal experience and why this was important for most of them for daily life. Maybe the most important for us is the left one by the president of the Latin American Society of Internal Medicine, saying that this course should be available to most health professionals in Latin America. What are our main challenges? Trying to keep this as an official course of the American College of Sports Medicine needs to make standardization, and these standard measures are not easy. As we change country to country, leaders and speakers, you can get difficulties in keeping the format. Of course, we need more information about the impact in clinical practice. We have not been able to have a method to evaluate the impact on patients because this needs cohorts to be captured and followed up and make comparisons between counseling by doctors that have been trained compared with this by doctors that have not been trained, and we have not been able to organize this part of the evaluation. We have been trying to make a follow-up of those 4,000 students, and we have probably the addresses and the emails and the names, and some of the people don't answer. So this registration and management of databases has been another challenge. Financing the course has been given for free in most of the countries. Some of the countries are starting to charge a fee for the course, but we have had lots of help from the food industry, from the Coca-Cola company, but also from the pharmaceutical industry, and giving this course for free. If we don't have this sponsorship, the course has to be charged by some of the countries that have not been able to get this sponsorship. These are some of the pictures. And now I want to present for this last minute the book we have been promoting for the last year, and you will find this book for all of you for free in the Exercise is Medicine stand. It's a Spanish written book as a guide, as a manual for exercise prescription in Spanish, where we have very little information. And it is basically the whole content of the course and some additional information about nutrition and interactions of physical activity with medications. And it's like a daily practice book you will find in our stand outside. The course has been written by Dr. Lobelo and me. These are the leaders of the Exercise Medicine program, Bob Salas and Adrian Hadber. These are the 7 chapters of the book: the importance of physical activity, the benefits, preparation, general principles, 6 different pathologies: obesity, cardiovascular disease, arthritis, osteoporosis, depression, anxiety, and cancer, medication use, and nutrition. And some attachments about basic exercises to do in clinical practice, and videos with testimonies of patients that have received medical counseling by doctors that have been trained in our course. Thank you. Thank you to the Coca-Cola company. Last word is just that the whole book issue and the courses in Latin America have been sponsored by the Coca-Cola company, by the Beverage Institute. It's our contact address.